So we'll be starting with aphorism 160. But as the dose of a homeopathic remedy can scarcely ever be made so small that it shall not be able to relieve, overpower, indeed completely cure and annihilate the uncomplicated natural disease of not long standing that is analogous to it, we can understand why a dose of an appropriate homeopathic medicine, not the very smallest possible. So we have to give a small dose, but homeopathic medicine or the dose of a homeopathic remedy can never be made so small that it will not work. Means it will never be basically less than the power which it can exert on the human organism. So in these aphorisms, like when we are talking about homeopathic aggravation, there are many theorists. Why I'm giving the word theorist? Because that idea cannot be put actually into motion, because it cannot be seen. That process cannot be seen. So when Dr. Hahnemann is saying that, there is a power of disease and then there is a power of medicine. So according to the therapeutic law of nature, the medicinal power should be always above the disease power. So then there are some theorists who basically started arguing at the time of Dr. Hahnemann, even till day they are arguing that let's make a homeopathic medicine so dilute, so small, so small that its power almost matches with the power of the disease or even goes below it, so that it does not produce, if it goes below, it cannot work according to the theory. But if it is, just similar, then maybe there is no homeopathic aggravation. The first point against these kind of theories is that, if they are similar, then they will not act. Because again, there is a third, this point in that therapeutic, that if they are of same power, then and similar also, they will not do anything. They won't do anything. It has to be higher than this. So the next thing is that homeopathic medicine, even if you keep diluting it, whatever you do, the dynamic nature, because I have discussed this earlier also, that the quantum or the quantum physics or the dynamism does not work like a material world. If we start putting the material concepts, like for example, if I have some drink, some sweet drink which is too strong, I'll add some water to dilute it. So that means the power of sweetness, it has decreased. That is in the material world. That is the law of material world. But the same thing does not go, or the same thing does not apply to the quantums or the energy world. The physics there is completely different. Whatever comes in contact with that quant, it starts gaining the quality of that quant. It is not a quantitative thing. The energy part is not a quantitative thing. It is more of a qualitative thing. I have given earlier also an example that if you go and sit near a sad person, if you, even if you are a very happy person and you sit near a person who is sad, who is in melancholy, you start sitting with him, you know, you you start getting that quality of that person. It is not about the quantity. Even if you are getting sad, his sadness is not decreasing. There is no material shift. If I put in the material world, in the Newtonian physics, if I put one thing from here to there, then here the quantity decreases and here the quantity it increases. But that does not happen in the quant. Even if you are having this sadness, if you are taking that sadness, that person's sadness is not decreasing. It might be increasing. It might be at the same, but it will not decrease. So it is more of a shift of the quality in the quant or in the energy world, in the energy field. But the same does not happen in the. So thinking about the dynamism from the part of mechanical physics, that is a very wrong way to see it. So that is what the theorists do. So to counter that thing, Dr. Hahnemann is saying, because in experience also, whatever you do, even in there will be coming aphorisms around 275, 280, where Dr. Hahnemann will say that even if you are diluting it, you are basically, the energy of the medicine after dilution, it increases. It does not decrease. So don't think that, if you are diluting it or if you are giving in water, then it will decrease. No, on contrary, it will have more parts to be affected. The surface area, it will increase. So the homeopathic medicine can never be made that small that it does not affect. The first thing is this. So whenever it will affect, it will have an appropriate homeopathic aggravation. So that is what is being told in this aphorism 160. We can understand by a dose of an appropriate homeopathic medicine, but it will produce this homeopathic aggravation only when it is appropriately homeopathic, means when it is a similima, then only it will affect in this way. Not the very smallest possible, does always during the first hours after its ingestion produce a perceptible homeopathic aggravation of this kind. So just few hours after the ingestion, it starts showing these homeopathic aggravations, this increase in the symptoms. In chronic disease, it may take some days. It can start on the same day. It can start on the next day. It can start after few days in chronic diseases. In acute diseases, it starts on the same, within few hours, within the same hour when it is given. You will see slight homeopathic aggravation, which is perceptible to a person who has good senses, and he also knows that this might happen. So footnote to aphorism 160, this exaltation of the medicinal symptoms over those disease symptoms analogous to them, which looks like an aggravation, has been observed by other physicians also. So Dr. Hahnemann is saying that these symptoms, this medicinal aggravation of certain symptoms, it has been seen by other examiners also, other physicians also. That he is saying that I'm not the only one who has seen this thing. Other physicians have also seen. They might not be able to apprehend or comprehend it, basically, that why this has happened, but they have noted this thing in their journals, in their whatever the essays or this thing they have submitted, published. Has been observed by other physicians also, when by accident they employed a homeopathic remedy. What happened? That they employed a homeopathic remedy by accident. For example, when a patient suffering from itch complains of an increase of eruption after sulfur, his physician, who knows not the cause of this, consoles him with the assurance that the itch must first come out properly before it can be cured. So one of the physician, when he gave sulfur to a patient who might have had this eruption like sulfur, and when he received this medicine sulfur, the itch increased. There was increase in the eruption, and the physician, he did not know why this happened. So he had to console him. He had to give a logic that it has to first come out before it can be properly cured or properly gone. He knows not, however, that this is a sulfur eruption that assumes the appearance of an increase of the itch. The facial eruption, which the viola tricolor cured, was aggravated by it as the commencement of its action, Leroy tells. So similarly, there was this physician Leroy who told that this facial eruption, which has a peculiar kind of a facial eruption, which was basically similar to the eruptions of viola tricolor. So when this remedy was given, it aggravated. But he knew not that the apparent aggravation was owing to the somewhat too large dose of the remedy, which in this instance was to a certain extent homeopathic. So the remedy, it was given in large dose and the medicine was homeopathic. The thing with the dose is, the more large you give the dose, and if it is a homeopathic remedy by chance, then the aggravation will be severe. The more stronger dose, the more severe the aggravation will be. License says in some of the journal, there's another physician Lyson who said the bark of the elm cures most certainly those skin diseases which it increases at the beginning of its action. So he went a step forward than the previous physicians, where he says that this is a kind of sign that the bark of elm, it cures most certainly those diseases where you always see that increase in the beginning of the action. So he came to this point that bark of M may uh, give relief to in other ailments or other skin diseases, but where in the beginning it increases the disease, it is most surely that it will cure that skin disease. Had he not given the bark in the monstrous doses usual in the allopathic system, but in quite small doses requisite when the medicine shows similarity of symptoms, that is to say, when it is used homeopathically, he would have effected a cure without or almost without seeing this apparent increase of the disease. So he said that if he has given in a very, very, very small dose, so he could have affected the cure even without or almost without seeing this apparent increase. Many times this homeopathic aggravation, it is too transient to even, the patient does not much complain about it. The physician, if he's not a very good observer, will even not know about it, this kind of homeopathic aggravation, because of the smallness of the dose. Right remedy, homeopathic remedy, and a small dose, and you will not see those kind of homeopathic aggravation, because many times we think that 1 m or the potency, the 10 m, if we give them, then that will cause the aggravation. You will see when we will go through the whole organon, that nowhere Dr. Hahnemann has written this word that the increase in the potency might give you a bad homeopathic aggravation, because this is a concept which has been going, many physicians, many good physicians, they have refrained from giving higher potencies because of this thing. I don't know from where it came, that if you give a higher potency, then the homeopathic aggravation will happen. If you give large dose, if you give multiple doses of any potency, the homeopathic aggravation will come. It is about the dose. If we give for example 10 drops of the dilution to someone, it's a too strong a dose. We are advised, that one drop of a homeopathic drop, one drop, it can basically medicate 500 small 10 number globules, one drop, and out of that we have to give 1 or 2 pills, you know so you know if you give 10 drops, then it is around 2,500 times more stronger than the smallest dose which basically is advised. 2,500 times stronger. So then that homeopathic aggravation which will be caused, then you either give 30 or 200 or 1 m or 10 m, that will be the homeopathic aggravation which will be too much for the patient. If we are giving in crude form, in mother tinctures or some, then also, because it is too crude form for the patient, too large a dose. So in those cases, you know, so then the physicians who have seen some kind of, rather than decreasing the dose, they start decreasing the potency, keep increasing the repetition and start decreasing the potency. But that does not solve what homeopathic medicine is meant to solve. Because the more we decrease the potency, we cannot invade in the deeper part of the bodies. We cannot go up level. It will be very superficial potency, acting very superficial in the whole economy. So we have to understand this. Yes, homeopathic aggravation is good symptom, but it is a symptom which will be very, very small. I have already that it might be aggravation of the symptom, but the patient starts getting better as a whole. His journals will improve, his general outlook to the things will start improving. So whenever there is a strong homeopathic aggravation, always look whether the dose was large or not, rather than the potency. So aphorism 161. When I here limit the so-called homeopathic aggravation, or rather the primary action of the homeopathic medicine that seems to increase somewhat the symptoms of the original disease to the first or few first hours, that is certainly true with respect to disease of a more acute character and of recent origin. So because in the last aphorism, Dr. Hahnemann has told that this aggravation will be for first few hours. So in that context, he is basically giving the next part, that when I'm saying for first or few first hours, it is basically in the cases of acute diseases which are of recent origin. This is certainly true with respect to diseases of a more acute character and of recent origin. But where medicines of long action have combat a malady of considerable or of very long standing, where one dose consequently must act for many days, we then occasionally see during the first 6, 8, or 10 days the occurrence of some such primary actions of the medicines, some such apparent increase of the symptoms of the original disease lasting for 1 or several hours, whilst in the intervening hours amelioration of the whole malady is perceptible. So he's saying that when I'm talking about the first few hours, I am talking about the cases which are acute and are of recent origin. But in the chronic cases, which have been there from long time, in those cases, when one dose is given and we let it to act for days, then we see that on the first 6, 8, or 10 day, even, you know, you can go more, sometimes 12, 15 days also, depending upon how long the disease is, what kind of treatment the patient has been taking. This action, the symptoms of the this increase in the symptoms, it is seen, for few hours in the days, but in the time of the day when it is not aggravated, they will feel much better in the general part. This is what I was talking about. I have given few examples when we have talked about this homeopathic aggravation last time also. That there was this patient who had increase in the headache, symptoms of pain in the head. But he said that I am feeling better because that headache or that heaviness of the headache was for few hours in a day, for few minutes in a day. But in the general, the other part, when he was not having headache, he felt better. Generally, commonly, the feeling, the first thing is, even Dr. Kent writes that the first change which you will start, even Dr. Hahnemann in the coming aphorisms, when we go into that, I will point out at that time that the first change you will see is in the mental part, in the disposition of the patient. They start feeling better. Many times the patient cannot tell you when the remedy is right, and they are going through the aggravation part, physical aggravation part. They cannot tell you what is right, but they will say that I am feeling better. Symptoms are there, everything is there. I will not say that it has gone, but I am feeling better. This is a very common statement which is given by the patients in the clinic, that I am feeling better. So that is a sign for you. Many things in their demeanor, many things which they used to worry about, they stop worrying about those things. Many times they might not notice, but that when the worrying goes away, when those kind of some unnecessary negative emotions go away, the patient automatically starts feeling better. So after the lapse of these few days, the amelioration resulting from such primary action of the medicine proceeds almost uninterruptedly for several days longer. So once this few days, this aggravation has gone on of some symptoms for some part during the day, when it has gone away, those aggravation has gone away, the amelioration is more continuous. It goes uninterruptedly for very, very long days. In many cases, I have seen for many months, it keeps on going. Even I gave the example of one lady in the recent Thailand workshop, that I saw her after 2 years. Someone would come to the clinic, take the medicine, and she would keep taking it. Medicine means it was SL. So not even repeated one dose for past one. I think the patient suffered from rheumatoid arthritis. So even like the amelioration is going on. Once a patient is well, the amelioration keeps going on. Footnote to aphorism 161. If the action of those medicine to which the longest duration of action is proper quickly expires in acute diseases. Now, this is another part about the homeopathic aggravation, that many times we think that For example, sulfur. Sulfur has a very long duration of action because it is a polycrest remedy. It has a deep action and very prolonged action. So we think that, okay, if we give sulfur in an acute disease, because, there are kind of practices. Dr. Hahnemann, I always say that, he was a man who had a very, who was beyond his time, who thinked in a way which was beyond in his time, and he had answered all those questions, all those ways of practicing, which people started doing, which was wrong. And he told in the aphorism that this would happen and it will be wrong. Don't do this thing. People still did it. People keep doing it. Now, the similar thing, the materia medica was divided into acute remedies and chronic remedies. It was divided. Now, these remedies can only be acute because they have a short duration of action. These remedies can only be chronic because they have a long duration of action. So the materia medica was divided. So it happened afterwards, after Dr. Hahnemann. If those doctors have given some thought to this footnote to Aphorism 161, they would not have done this thing. But just to ease the way of prescribing, that in acute, just think about these remedies. In chronic, just think about these remedies. Just to ease the way, they just did this thing. So here Dr. Hahnemann is saying even those medicines who have longest duration of action is proper quickly expires in the diseases. But even in the acute disease, if a sulfur is given, its action will quickly expire. It will not give a prolonged aggravation because it is a longer period of action. That prolonged aggravation will not be given. It will act in the same way because right now the sulfur is acting on the acute disease, only on the acute symptoms which the body has recently presented. So the same sulfur will be acting as a acute medicine with a smaller action. And if you give aconite in a chronic disease, like I discussed a case of urticaria of a middle-aged man who had this urticaria from past 7 or 8 years, and maybe next time because we will be going for the materia medica part more in the future. So next time maybe we will talk about the aconite in the chronic part, how to recognize the aconite in the chronic part. Okay. So when given in a chronic case, it acted like a chronic disease. It's I gave I have that case with me. I will show that case also. I will show the prescription part, that when I gave aconite, I did not repeat it aconite for 3 months. Although in our mind, we have this aconite has a very short action. Yeah, in acute cases may be seen that you need to give aconite twice or thrice, but that basically depends upon the violence of the disease. That depends upon how powerful the disease is. Or if you are giving a low potency where a high potency is required, then you might have to repeat it again and again. So it is better to give the patient the required potency. But the same medicine, in my experience, it has worked for 3 months. Even then, afterwards, because some old symptoms came up, that was the need the aconite was repeated again. So similarly, Dr. Hahnemann is saying that if the action of those medicines to which the longest duration of action is proper quickly expires in acute diseases, the action will be of shorter nature. It will quickly expire. Most quickly in those that are most acute. The most acute the disease of more recent origin, the more quickly the primary action of the remedy will expire. It is proportionately long lasting in chronic diseases, and the same medicine will have a more longer action in the chronic diseases which are of psoric origin, and hence it happens that the anti-psoric medicines often do not show any such homeopathic aggravation in the first hours, while they do so later and during various hours for the first 8 or 10 days. So the same medicine, sulfur, who has shown very quickly the reaction, or sorry, the action in first few hours in an acute disease, might not show for many days that reaction in a disease which is of chronic nature. So even the action of the same remedy basically depends upon the what kind of, ailment is going on. I will not use the word disease, because then disease we relate with the name of the disease. But whether it is chronic or whether it is acute, so we have to understand that the same medicine may have very quicker action when the disease is acute, and a prolonged or a delayed action when the disease is chronic. So we have to wait. Just because sulfur gave very quick relief in an acute case or in an acute episode, do not expect the same thing of the sulfur in a very strong, very chronic case, a case which is 30 years old, 40 years old. Don't expect the sulfur to do the same within few hours or within few days. It might even take 1 or 2 months in some cases, where the disease is more rigid. There is so lack of reaction in the body. The sulfur will also take some time to react. I'm just giving an example of sulfur. It is not about sulfur, it can be any medicine. So sometimes happens, owing to the moderate number of medicines yet known with respect to their true pure action, that but a portion of the symptoms of the disease under treatment are to be met within the list of symptoms of the most appropriate medicine. Consequently, this imperfect medicinal morphic agent must be employed for lack of a more perfect one. So this fifth aphorism of Organon, it came out in, I think, 1833. So whatever Dr. Hahnemann is writing, he's writing in that part of the time, in that part of concept of the time. It is transpiring at that time, whatever he is writing. So I think around 1833, because I was making a list today in the Materia Medica Pura also and the chronic diseases, I think he had 70 to 80 remedies with him. Okay? So he was having only those 70 to 80 remedies to give from. So he's writing this aphorism at that time, that sometimes happens owing to the moderate number of medicines. He knew that I don't have a very wide array of medicines with me. There are so many medicines which are yet to be proved. So I don't have that much medicines with me right now. So owing to that fact, yet known with the respect to their true pure action, that but a portion of the symptoms. So what happened is, he's saying that sometimes only a portion of the disease or the portion of the symptoms of a patient who is, we have to treat, you can only find a remedy which basically matches the portion, which is just similar to some portion of the symptoms, not to the whole malady, not to the all characteristics of the case. So consequently, we will say that this is an imperfect medicine, but still, because we do not have more perfect one, so it is better to give this imperfect medicine to that patient. But what will happen after giving it? He also cautions us against that thing. In this case, we cannot indeed expect from this medicine a complete untroubled cure. He's saying that such a medicine will never give you a complete cure, and it will not be untroubled. Means don't expect aphorism 2 that it will be a gentle cure, it will be a permanent cure, or it will be a cure where the patient might not be bothered somewhat. For during its use, some symptoms appear which are not previously observable in the disease. Because when such a medicine means a remedy which is partially similar to a part. Okay. So now this will be a learning in understanding when we have given a medicine, whether it is a similimum or partially similimum. Okay. So we'll get to that part. So what will happen is, for during its use, some symptoms appear which are not previously observable in the disease. So there will be coming of new symptoms. Some new symptoms will come. Accessory symptoms of the not perfectly appropriate remedy. So from where are these symptoms coming? Because the remedy was not perfectly appropriate, it was not perfectly similimum. So some of the symptoms of the medicine, they are produced in the patient. This does by no means prevent a considerable part of the disease, the symptoms of the disease that resemble those of the medicine, from being eradicated by this medicine. So He's saying that although this new symptoms are coming, although the medicine is not perfectly similar or similar to the case, but it will cure, it will considerably remove that part of the symptom which it was similar to. Okay, it has produced some new symptoms. It has not removed completely the symptoms which were already there, but some part of the disease or some part of the symptom, some symptoms of the whole disease, they will be eradicated by this medicine, thereby establishing a fair commencement of the cure. So it will start the cure, but still this does not take place without those accessory symptoms which are, however, always moderate. Then the dose of the medicine is sufficiently minute. But he said that it will never happen without the accessory symptoms, the new symptoms coming up, the symptoms of the medicine, although they will be very moderate because we have given a very small dose. But if you give a very strong dose in such a case, then those accessory symptoms will also be very strong. So another reason to give a very small dose, that even if the dose is partially similar, not properly. So even if the some new symptoms are coming up, although there will be aggravation of the symptoms which are similar, but then some new symptoms are also coming up, they should not be of greater strength. So to avoid that thing, we also have to give the minimum or a very minute dose. So we can add this to the another reason. So from here we come to this part that we can understand our follow up. When some new symptoms are coming up, whether they are coming from the oversensitivity of the patient, the first thing, because there also it can come in idiopathic patients. When a patient is oversensitive, he might bring out one or two symptoms of the medicine, but they subside also very quickly. In this case, the accessory symptoms that take longer to subside, or sometimes, but I have seen that some portion of them remains also. It becomes part of the, because Dr. Hahnemann will be talking about this in the coming few aphorisms. I think if possible, we can talk about those aphorisms, or we will talk about them in the next time. But yes, this happens that few of the symptoms they remain also, and they start becoming a part of the disease, the original disease. So next time we have to take those symptoms also and the other symptoms from the old part and then find a new remedy. But in his case, what he is saying is that I am doing this because I do not have the proper medicines which can basically, you know, cover the whole scenario. But nowadays, many people, again, because when I have listened to something, when I heard about some concepts which are prevailing in the homeopathic community, so I think it is my duty, according to the Organon, from the point of view of the Organon, to caution the doctors, the students about this thing. Many people they say that it is justified in the Organon to do some zigzag method. Give medicine for one portion of the medicines. Once it is removed, then give for the another portion. Once then it is removed, then that is not given anywhere. They'll go through the aphorism. It is not given anywhere. This is the part which they take out of context. But the context or the properness is because Dr. Hahnemann has said that I do not have those many medicines which I have wanted. Otherwise, this condition would not have been there. Now, the medicine so well proved after Dr. Herring and others who had done provings, Dr. T.F. Allen, we have so big array of medicines that we should not even think about this thing that that zigzag, that remove one portion, remove the other one, then remove the third one. We are, it might happen. I am not saying in our knowledge we might be lacking in our knowledge. I am talking about the intention. I'm not talking about someone's knowledge. There are so many cases which I have experienced that I have given a partially similar in many cases, but that I will relate or I will say that that is because of my knowledge. But if we are keeping an intent that this way the cure can be done, or we can give relief to the symptoms, or the patient, can have a control over the patient that he should not go away, then I am talking about the intent. All through the organon, I will be talking about the intention. What kind of intention, with what kind of intention we are going into practice. So here I'm just clarifying that what kind of intention we should have. Right now we have there's so many medicines, so our intent should be to find a complete simillimum which should cure the case. And beware that if we see such kind of things happening, some accessory symptoms which are coming and remaining, we should be wary that my medicine was a partial simillimum, it was not a complete simillimum. I should go back, I should study the case again and come up with a more simillimum remedy that can cure the case. But yes, I will know that I was wrong here. I missed something. I missed something in the case. So the small number of homeopathic symptoms present in the best selected medicine is no obstacle to the cure in cases where these few medicinal symptoms are chiefly of an uncommon kind and such as are peculiarly distinctive characteristic of the disease. The cure takes place under such circumstances without any particular disturbance. So if a homeopathic symptoms, some medicine has homeopathic symptoms which are small in number, but then you have a case where it fits completely. Cure, no obstacle. So just because some homeopathic medicine has not given many symptoms, when a medicine was proved, it was not has not given many symptoms, that never becomes an obstacle to the cure. Okay, that just means that we have to find, like sometimes when I'm telling about some remedies, like few days back we were talking about I think there was some medicine which we were talking. I it just got. I told the students who were there that when this medicine is required, no other medicine comes close to even moving the case, because those are the medicines which have very few number of symptoms, but those symptoms are so characteristic that they are not present in any other medicine, or very few remedies contain those kind of characteristics. So just because there is a small remedy or a few number of symptoms are there, that does not become that this medicine should never be given, or it becomes an obstacle that we don't have a very big picture of the medicine. So he's saying that in the cases where there are few medicinal symptoms, but those few medicinal symptoms are of uncommon kind and have peculiarity which is characteristic of the disease, so they both match, they are both similar. The cure takes place under such circumstances without any particular disturbance. The cure will take place if you have a smaller remedy and a disease whose basically particulars, they matches, the peculiars matches with the uncommonness of this remedy. But then next part, in context to that part, if however among the symptoms of the remedy selected, but if we have selected a remedy and its symptoms are that there be none that accurately resemble the distinctive characteristic peculiar uncommon symptoms of the disease, case of disease, if the remedy corresponds to the disease only in the general vaguely described indefinite states, some nausea, some debility, headache and so forth, and if there be among the known medicines none more homeopathically appropriate, in that case the physician cannot promise himself any immediate favorable results from the employment of this unhomeopathic medicines. So he's saying that, so the remedy which we have selected, it has nothing characteristic to the disease, but it just matches the vague symptoms which are commonly found in almost all the diseases, like nausea, some kind of weakness, some kind of headache, some kind of other aches, or some kind of lassitude in the body. So he says that a physician cannot promise himself. He should be very wary, because he will most probably he will not get any favorable result, any amelioration from this kind of unhomeopathic employment of the medicine. So such a case is however very rare, owing to the increased number of medicines whose pure effects are now known, and the bad effects resulting from it, when they do occur, are diminished whenever a subsequent medicine of more accurate resemblance can be selected. Now many times it is commonly said that the homeopathic medicine cannot have bad effect. Now this is the aphorism 166. We have to read it very carefully. Such a case is however very rare. So he's saying that this case which he has described, this 165, he's saying this case is very rare because we have this increasing number of medicines now. Every day medicines are getting proved. Even in his time, he's saying that the medicines are getting proved. So this kind of cases are becoming very rare, where we will not know about the characteristics of a remedy. We are proving the medicines, new medicines are being proved. So we are getting new characteristics of the medicines. So this case is very rare. Whose pure effects are now known. So we have known the pure effects, and the bad effects resulting from it, when they do occur, are diminished whenever a subsequent medicine of more accurate resemblance can be selected. So when it is a partially simillimum and a bad effect results from it, when it is not completely accurate and a bad result, some accessory symptoms are coming. So we cannot say that the after homeopathic medicine, you know, especially if the doses are large, if we are giving even in the small doses, those bad effects can be seen, especially where the medicine is a partial simillimum. But yes, if you give a very small dose, that effect will be of a smaller character. But we should be very quick in understanding that this is somewhat wrong. New symptoms coming means something wrong is happening. So either a patient is idiosyncratic or the disease has moved to the more bigger phase. So we have to have our parameters very, this is nothing, see, this is not to create fear, it is caution. Caution should not be confused into fear. Because if we don't have a parameter, if we don't have a compass to where we have to go, then we will not even know where we are going. So these kind of aphorism, they are like a north star, who are basically guiding us in a moonless night, on a moonless night, where the north star is. So these aphorisms should be used or should be understood in that way, that okay, this kind of symptom if they have, okay, I should stop, at least not repeat that remedy again, because now I know that it is a partially similar, no? So don't repeat any new this remedy, but go for a remedy which can be more accurate, which can more accurately resemble the whole thing, the new symptoms also, the old symptoms also, the characteristics of all those similar complete part. So thus, if there occurred during the use of this imperfectly homeopathic remedy, first employed accessory symptoms of some moment, then in the case of acute diseases, we do not allow this first dose to exhaust its action. So he's saying that in an acute disease, if you have given a medicine, it is an imperfectly homeopathic remedy. Imperfectly homeopathic, very beautiful word. Some part of it is homeopathic, but it is imperfect, not perfectly homeopathic. Some part is homeopathic. So imperfectly homeopathic remedy, what will happen is that as soon as they start showing that accessory symptoms, we should not wait, that let the action of medicine basically be complete. We do not allow this first dose to exhaust its action nor leave the patient to the full duration of the action of the remedy. As soon as you see that these accessory symptoms have started coming up, for example, a patient was in acute stage, he didn't had any taste of mouth, normal mouth taste, and suddenly after the medicine, something might have decreased, but he started developing a saltish taste, or his bowel movements were completely normal and he suddenly started developing diarrhea, or the appetite was okay and he suddenly started getting more increased appetite. That is some symptom which is accessory. It has a new symptom, and we should not wait for it to continue or wait for some time that let the homeopathic aggravation resolve. No, but we investigate afresh the morbid state in its now altered condition. So whatever the altered is, we have to see in this condition and add the remainder of the original symptoms to those newly developed. So the original symptoms plus this newly developed symptoms, we have to trace a picture, a new picture of the disease, and start finding a remedy, start investigating, again, new manner. Now again coming to the same part, because I uh, try that you do not forget the context, that this is in context to the time when the remedies were less. Only few remedies were there. So this is to that context. Okay. Nowadays our intention should be that at least in acute this should not come. My knowledge should go up that part, that this state should not come. But yes, if it comes by lack of my knowledge, then yes, this is the path which I will choose immediately, that I will take note of the all whole symptoms and try to go for a more perfect remedy. We shall then be able much more readily to discover among the known medicines an analog to the morbid state before us, a single dose of which, if it do not entirely destroy the disease, will advance it considerably on the way to be cured. So then taking that picture, that complete picture, we have to give a medicine which is analogous to the morbid state, which is similar to the morbid state among the known medicines, whichever we know. Okay, among those medicines which are present in our materia medica. So he's saying that it might not entirely destroy the disease on itself, because it might not cover the whole portion again at that time, but it will advance it to considerably to the way to be cured. But yes, it will start the curing part, it will start the amelioration, it will start the an action which we will know that it is going towards cure. And as we go on, if even this medicine be not quite sufficient to effect the restoration of health, examining again and again the morbid state that still remains and selecting a homeopathic medicine as suitable as possible for, until our object, namely putting the patient in the possession of perfect health, is accomplished. So he's saying that we will keep doing this exercises, examining again and again, interrogating again and again which symptoms are left, which symptoms are left, which are there, which have come up, which have left, and keep giving the homeopathic medicine suitable as possible, so that we can slowly and slowly take the patient towards health. Now, this is completely in a different scenario. The whole scenario when we had known less medicine, the provings of the materia medica of very few medicine was there. Now using this part to whatever that practice is, using this part to say that this is a right way, to give it as an evidence of the wrong intention, that is what I consider that that something which is not good. It basically kind of showing a wrong way to the homeopaths and the students. So that is why the knowledge of organon is very important to us, so that at least we can know that what is wrong. Right, we will learn, and we have left all wrong. The only thing which will be left will be the right part. So at least to know that this is wrong, this is not the right way. So for that we need to know the organon. So organon is not about, it is, I think that we, after you go through the organon, even in the end, you will, if someone asks you that, okay, what is a organon to a homeopath? There will be, I think the words are very few. We have very less words that we cannot describe what organon is basically to a homeopath. Whether it is a guide how to practice, whether it is guide how to refine a remedy, or what not to do, or how to live also, what needs to be a homeopath, it is an endless thing. There is no perfect definition which can be told what organon is to a homeopath. There is, I think there is also, like homeopathy, it is also a limitless thing, organon, what it is. But whatever you feel, when we are going, it is all about feeling. I've spoken about this again and again, that feeling what Dr. Hahnemann is telling us, listening through his mouth, listening through his words, feeling that thing, that okay, he's telling us, one small one aphorism, and you can, when you feel, you can take out so many meanings out of it. That in this part he has told us what not to do. He has given us the definition, the characteristics of what you will see when you have given an unperfectly homeopathic remedy, means a partial simile. It is not completely similar to the case. What you will see in the patient, what those symptoms mean, what does a large dose will do to the patient, what does a small dose do to the patient, why small dose should be given. We have not even gone to the part of dose, it is completely in the end. But you realize that when you go to that part, you have already known how much dose you should give. He has already told you in all those aphorisms. So Organon is all about absorbing inside. We have to absorb it. You cannot, remember it. It has to be absorbed with emotion, with that feeling. So, okay, we will stop at 168. And please go through the aphorisms once again, 160 to 168, because they are very important aphorisms. Because the thing is that they tell you what not to do. They tell you what to do if in case you have a wrong this thing. And to see the homeopathy, the way you want to practice it is your intention. You can practice anyway, but it will define your intention. Whether your intention matches Dr. Hahnemann's intention or not. That is the only way that can be seen through Organon. Even in my case, even in others' case also. If you want to see what kind of intention a homeopath carries, it can only be seen what Organon tells us from knowing that thing. So even when I look at myself, when I am seeing a patient, when I look at myself, when I see my unconscious part at that time, when I am seeing the patient, just before coming to the Organon class, I was having this online some patients in Thailand. So even when this becomes, when you go through it again and again, it is a practice. It becomes an unconscious part that a question comes to your mind when a patient is sitting in front of you, that what do you want to do? So that defines the attention, that what do you want to do? What answer comes at that time? Whether I should think about what I want as a financial part, whether I should think about what I want as some kind of social or respect part, or that deeper meaning, the first aphorism that no, I just want to cure this patient. That is the only. So once that intention is set, the whole thing starts building upon it. And the Organon started with the definition of intention, that the only aim or the mission of a physician is to cure the sick. The first thing was the intention. That intention of a physician should be that my patient should be cured as it should be. I'm not going to relieve his symptoms. I'm not giving the medicine to suppress his symptoms. I'm not giving even to treat the headache or stomach ache or some kind of apathy or cold and cough. My intention is to cure my patient as whole, as complete as he is. My cure should be that complete as my patient is. So the first aphorism, it puts the intention in our mind. So it should go more deep in us. When we think about it, it will go more deep, and it will become an unconscious habit. When a patient is in front of you, sitting in front of you, you will question yourself. The question will come, what do you want? And your intention will speak that I want to cure. And then the whole thing starts matching. So that is the purpose of understanding Organon. It produces that is why I'm saying that in words it cannot be defined what it means to a homeopath. So you just have to feel, and you just have to see in yourself that what changes the study of Organon brings in you. Before you started studying Organon, how you were, and after you have completed studying Organon, how you are. You will see that you are not, at least not that person which you were when you started it. So with that, I will take your leave.